And we are now live.
Awesome.
Okay, good evening, Dolores. I saw you here much before we went live because you are on YouTube, of course. Thank you for coming, okay, in any case. If you'll excuse me, I'm going to share for a few minutes. And you can see that I'm here with Georgia already. I think she'll be doing some sharing too. Also, knowing Dolores, I think she'll be doing some sharing for us as well, Georgia.
Thank you, Dolores. If I try to go on social media while I'm on a podcast, I get distracted and then all bets are off. So I'll share after we're done because, I'll be like, oh, look at these notifications. I better check in with that and forget all about what I'm doing.
Oh, there's Kay and there's Laura. I can see them.
Hello.
In the comments. Hi, Laura. Hi, Kay. And there are a few pages I have to share too. Like the nonprofit, the Center for Public Purpose. I am the acting president of the Center for the Public Purpose, which, by the way, by some strange coincidence, is an Oregon but nonprofit. I am getting a bit distracted here myself.
See, it happens.
It certainly did. Here we go. Okay, folks, I'm not going to take much time to share tonight because I see that a number of you are here. Hi, Amber. How are you? Nice to see you here. So I'm going to rely on you to do the sharing for us. So I thank you very much beforehand. I know you will do a good job. That I'm here with Georgia. She'll be so. Those were Facebook delays that you were hearing. We are now done with those. I'm putting us back in the picture fully. God bless you.
Thank you. That's one of the challenges with me is I have really bad chronic allergies. So every once in a while I might just have to mute to sneeze.
Okay, quite all right. Okay, so again, good evening, everybody. Good evening, Dolores. I see you're here on Facebook as well as on YouTube. And hello, Amber. It's great to see you here. And I know we have a number of other people here too, but I can't tell who you are because you haven't checked in with the comments lately. So tonight, as I'm sure you know by now, my guest is Georgia Davenport, who is the operations director and the founder of Whole Washington. And she's going to tell us about her story and Whole Washington's story. And I'll be interrupting from time to time with comments and questions as usual because I can hardly contain myself. And so I think we're going to be in for a very interesting evening. So thank you all for coming. Keep on sharing, please. We want as much company as we can get here. And so, Georgia, the con is yours. And please tell us a story.
Okay, will do. Well, I started being interested in politics right after 9/11, so a very long time ago now. I became really involved with the anti-war effort and helped organize protests in Albuquerque, New Mexico, where I'm from. And no matter what we did, I actually created one of the largest anti-war websites of that time called stopthewarmachine.org, which ironically, I'm right now in the middle of reformatting so that it's brought up to date because it's about 20 years old now. But no matter what we did, nothing changed. Nothing stopped that war. I mean, we're still there. So I got really, really disenchanted and cynical about our political process here in the United States. So I checked out. I continued voting for years, but I didn't do much else until a certain senator from Vermont announced his candidacy. And I'd been following Bernie Sanders for a long time. And one of the reasons is because he stood up against the anti-war. Or he stood up as an anti-war activist, rather. So I really admired him for a long time, and he said that he's going to run for president. And so I said, well, I have to get involved and do everything I can to help him win. So I was then living in Washington. I'm still living in Washington, but now I'm on the east side of the state. At that time, I was south of Seattle. So I became heavily involved in the Democratic Party. I ran to be a PCO, which is a precinct committee officer. I volunteered for the Bernie campaign. I organized barnstorms. I don't even know how many thousands of people I text banked and phone banked and donated hundreds of dollars to his campaign. And eventually, actually, I went to Philadelphia, drove surrogates like Susan Sarandon and Danny Glover to the national convention. So I really went all in. And then I got a little disenchanted again when he conceded to Hillary Clinton. So I started learning.
That was quite a blow to me as well.
Yeah, I think a lot of people really were hurting after that. I started learning about initiatives right after that, just because political candidates, sometimes you invest a lot of energy and time in them and that it doesn't turn out. So whereas initiatives, they do exactly what they say they're going to do. It's a piece of legislation, you get signatures for it, gets on the ballot, you vote on it. If it passes, it's law. There's no like neoliberals or conservatives who can tank it. So I really fell in love with the initiative process, and I became a staffer for Initiative 735, which in 2016 passed by 64%. And that was the initiative to overturn Citizens United here in Washington State. So after that passed, we kind of were brainstorming, some of the staffers with 735, about what we wanted to do next. And a lot of us thought healthcare, passing universal healthcare on the state level would be really, really beneficial for the 500,000 Washington State residents who had zero healthcare coverage. So we founded Whole Washington. We are, as you like to say, and I love the term, fight on all fronts organization. We also support the Medicare for All bills nationally. I actually remember asking Pramila Jayapal a few years ago if she would be the prime sponsor of Medicare for All. I was the state committee member for the Washington State Democrats in the 33rd legislative district. So that's one of her LDs that her area covers. And she visited our organization, and I asked her that question, and she said yes, because at that time, the historic prime sponsor was retiring. And so I asked her if she would be the prime sponsor for that. I went to the Medicare for All hearings. So basically, we founded this organization to fight on all fronts, like you say, for Medicare for All nationally and state-based universal health care. And we ran an initiative. Oh, sorry, your finger's up.
Oh, yeah, my finger's up. Hang on a second. When you spoke to Jayapal and asked to become the prime sponsor, was this when Keith Ellison was retiring?
No, it was when Conyers was retiring. So Ellison became the sponsor after that. Yes, but then shortly after that, for whatever reason, I'm not really sure why, he released the bill and decided not to sponsor it. So, yeah, there was a lot of turmoil in the Medicare for All community around the Conyers.
But when you spoke to Jayapal about that, it was before she was in line to actually become the prime sponsor.
Yeah.
Right?
Yeah.
So in one sense, okay, it can be said that perhaps she got the idea from you.
I'm sure she really ran on Medicare for All when she got elected, and she was one of the sponsors of HR 676. And then when Ellison reintroduced it, she was a sponsor then too. So I know she would have, even if I hadn't asked, but since she was my representative, I really wanted to say my representative was the prime sponsor of Medicare for All. So that's why I asked the question at that point.
Okay. Yeah. Please go ahead.
It's a source of pride for me that she was ever my representative. So unfortunately now I'm on the east side. So I have Kathy McMorris Rogers, who
I know she is. I know she is.
Yeah, there's no chance I'm going to be able to say that she's a sponsor of Medicare for All as my representative, unfortunately. So, in 2018, we ran our first ballot initiative, which was oh my gosh, you're drinking wine. That gives me free reign to drink my beer.
Yes, this is actually, this wine is $3 Chuck.
Oh, that's great stuff.
Yeah.
So I was saying
$3, it's gone up to $3.49.
Oh, that's crazy.
Yes, it's an effect of the pandemic.
Yeah. Yeah. Well, prices are going wild here, like not just 49 cents. But we can talk about that in a little bit if we get to the subject.
A shortage of glass. So they attribute it to a shortage of glass. That's what I thought that was an interesting story.
That makes sense. I mean, right now here in Eastern Washington, we have a shortage of hay. So ranchers have been culling their herds, and prices of meat are just skyrocketing. But completely different subject. Sorry, I digress. But
that's all right. I was the one who digressed at first.
So in 2018, we ran Initiative 1600, 100% volunteer effort, and we got over 100,000 signatures for universal health care. And that's not quite enough.
124,000, I believe, right?
I think it's about 104,000.
Okay.
But yeah, in Washington State, we need 8% of the turnout in the last gubernatorial election to make the ballot, which at that time was about 350,000. So we didn't make it, but for a volunteer organization, completely grassroots, I felt like that was very, very solid.
Right, a victory.
Yes, exactly. And we only spent $70,000 on that campaign, including a $15,000 study by Dr. Gerald Friedman, who is the world-renowned single-payer economist who actually did the studies for National Medicare for All and a lot of other state efforts.
Yes.
So we were reorganizing. We got a lot of advanced pledge signatures from volunteers saying, next time you do this, I'm going to pledge to collect 2,000 signatures or 5,000 or 100 or 10. And then we were going to launch in 2020 and COVID-19 hit. So we postponed our campaign till this year, and we were hopeful that we could launch and collect the signatures we needed this year, but then Delta hit. And part of the things that you need for an initiative campaign are big events with tens of thousands of people, like Folklife Festival, Pride Parade. And if those things are happening virtually, you can't collect signatures at them. So we had to postpone the campaign again, but we still have our bill in the Senate. Actually, last time it was introduced, we had twice the amount of sponsors than we had the session before. So progress there, and that's SB 5204.
Okay. And so now you have taken us very quickly up to the place where we are, okay, at present.
Mm-hmm.
So you've had to suspend the signature campaign,
Mm-hmm.
but you're not suspending the activism at all, right?
No, we continue. And like I said, we still have our bill in the Senate, which we're going to be pulling out all the stops to try to pressure people like Senator Annette Cleveland, who's the chair of the Healthcare Committee, Democratic chair of the Healthcare Committee in the Senate, to get her to schedule a hearing for our bill and pass it out of her committee, which she's never done for a legitimate universal health care bill. It always gets stuck in her committee. And no surprise, she takes tens of thousands of dollars from pharmaceutical and insurance companies. I don't think that's a coincidence.
That's simply public information.
Mm-hmm. Oh, yeah. In Washington State, we're very lucky. We have this website. It's the PDC website, where any money that's spent on a political campaign, all donations and expenditures are tracked through the PDC. So you can go on to Annette Cleveland's PDC page and see all the, hospital PACs, dental PACs that she's taking money from.
So we can see evidence of the best state government that money can buy.
Yes, right. the corruption.
Yes, through and through corruption, as you can see in many states, mm-hmm. probably in all states, pretty much. Mm-hmm. Okay, so while you are not able to get any more signatures, what are you doing to build the movement so that when you can go on the ground again, it will explode?
Yeah, so one of the things that we did this year with our petition is we had a place where people could put their email addresses and phone numbers so we can contact them later. So we're still doing data entry to get all the, I think there was like 20 to 30,000 people who signed in the last few months to get all their information so that we can contact them when we launch our campaign again and hopefully recruit them to be volunteers in advance of that. I know that the amazing Laura Fielding, who's responsible for the Red Berets for Medicare for All, she's...
The amazing Laura Fielding is here tonight. As is the amazing Lisa Theobald as well. And the amazing Jeffrey Denton. I see them all here. And Amber Grigo is here.
Nice.
As well. And there are quite a number of other people here who have yet to check in. So we encourage them to check in and everybody to keep on sharing. Anyway, please go on.
Yeah, I was just going to say, many of the Red Berets have been planning other events around the state, partly to influence Representative Derek Kilmer. They just did a big event with Whole Washington in Tacoma to demand Derek Kilmer co-sponsor Medicare for All. But then also later, I think it's going to be in November, there's an event focused on trying to push Senator Annette Cleveland to pass our bill out of committee. So we're still working. Also, there's this amazing documentary. Kenny Ballantyne's making a documentary about not just Whole Washington, not just Medicare for All, but all grassroots efforts across the states, because there are many little organizations and bigger organizations actually working within each state. They have their own bills. And, every time, what I really like about initiative campaigns in particular is that you are having to go and talk to people outside your echo chamber. A lot of organizations, they just have meetings after meetings after meetings with their own people that are already on board. And so when you have like these state efforts, like initiative efforts, you're actually going out into the streets and talking to people who might not know about what you're doing, but really want universal health care. I mean, one of my favorite things to do with Initiative 1600 was if I was in a restaurant, I would just put my petition in the window. And on the back of each petition board, we have like, I'm a volunteer for whole Washington, sign my petition to get universal health care on the ballot. And people would come in and say, we need this. You know,
Great.
Last month, I ended up getting charged a $7,000 deductible, even though I have good insurance. So, I mean, but they don't hear about initiatives. The problem is with the exception of present company, a lot of people don't want to talk about legislation. They think it's boring. They want to talk to candidates.
Yes, so I know.
Getting information out about what bills are really important in the legislature or initiatives is really difficult. So I'm grateful that you're giving me this opportunity to talk about our efforts.
So speaking of not just candidates, but also laws, legislation. Tell us about I-1362.
It's the whole Washington Health Trust. So it's the same bill essentially that's in the Senate right now. And it would be 100% coverage, zero copays, zero deductibles. We modeled it after the Medicare for All bill, which we think is the gold standard. Vision, dental coverage. It's fantastic piece of legislation. One of our goals was not just to provide health care for every Washingtonian, but to balance out our regressive tax system. Actually, people think, oh, you live in Washington State. It's, run by Democrats, so it must be really progressive. Well, sure. We have the most regressive tax system in the United States. Every year, our property taxes go up, our sales taxes go up, but we don't have an income tax. So people like Bezos and Gates and all the 12 other billionaires who live in Washington State don't live here because they love it. They might like it, but the main reason is because they don't have to pay any income tax. So we wanted to balance some of that regressive taxation in our bill. So that was one of the things that we asked Dr. Gerald Friedman and our initiative writing committee to really, really focus on, is making sure that the working class families in this state get a little tax relief.
Yes. Okay, so to go back a little to whole Washington itself, as it exists now, is a corporation, right?
Mm-hmm. Well, a 501c4 PAC.
Okay, great. 501c4 PAC. Good. That makes it extremely precise.
Mm-hmm.
Okay, now, when I-1362 passes,
mm-hmm.
and you notice I said when.
Mm-hmm. Okay. I like it.
Yes. What will be the relationship of whole Washington to the WW Health Trust? Okay, at that time, is there going to be any relationship at all?
Well, we'll be keeping a very close eye on it. One of the things that I've learned in politics is that you can't just say, here, do this to politicians and then expect them to do what you want them to do in good faith. So not only will we be watching what they do, although it is like a 64-page document, it might be even longer now that we've made some good changes. So it's very direct, it's very detailed. We still will be keeping a close eye on how they proceed, and also using all of that momentum to push for national Medicare for all and other state groups, helping other state groups succeed.
Right. Okay. So what I'm trying to get at here is, what exactly will the WW Health Trust be?
So it creates 3 committees, essentially. Some of them, they're appointed by the governor. And there's a provider committee, a citizens committee, and You're getting into the weeds with me a little bit here. But the three committees basically oversee the whole healthcare system. It's replacing private insurance with a more affordable system that gold standard plan, basically.
Right, it's a gold standard plan. But in terms of the organizational structure, the state will be setting up, an organizational structure itself. And the three committees are going to oversee it, but they're not the organization itself.
They will be. They'll be working with the HCA, which is the already existing healthcare authority here in Washington State. But whole Washington we could be like more of a watchdog organization, but we're not going to be directly affiliated with the committees that come out of it, if that makes sense. So
yes,
legislation. Yeah, go ahead.
But what I'm really asking about is the nature of the organization that's going to be created by the bill. Okay, in other words, there will be people working for that organization. That organization is essentially going to be charged with the execution, the administration of being the payee for healthcare. In other words, the intermediary between the state government and the providers, right?
Yes.
And that organization is going to employ people. People are going to work for that organization. And that organization is going to replace the insurance companies.
Right.
Right?
End goal. Get rid of private insurance because, their whole motive is to deny.
Yes.
Right.
Yes.
Is to deny care so that their CEO can get their 8th yacht or whatever.
Right.
So.
So the organization itself then is going to take over the functions of an insurance company. Now, in terms of its structure, is it going to be a government-owned insurance company? Is it going to be a division of the government itself? How is it set up under the initiative?
Yeah, it's state-run nonprofit, and under the oversight of the three committees that the trust forms in the legislation.
Okay, so
that way, like, for example, one of the issues that a lot of providers have with Medicare for All, even though it's incorrect, is like Medicare reimbursement rates aren't high enough. And so it scares them to hear Medicare for All. So one of the things we wanted to do is create a provider committee so that the providers can negotiate directly with the trust and they feel more comfortable. I don't know if you've studied what happened in Canada when they tried to pass their universal healthcare province by province, but the doctors went on strike.
Yes, I recall that. I am old enough to remember the doctors going on strike.
Yeah, so that was one of like the motivations with having these three committees is making sure that providers are not going to rebel. At the time, what Canada did was quite genius. They just brought in doctors from the NHS. I don't know under the current situation, though, with doctors as strapped as they are, I don't think that we will be able to import doctors from the NHS at this point. So it's really good foresight of the initiative writing committee to have a provider committee.
Yes. Okay, I certainly agree. But to move back into the structure again, okay, it's a nonprofit corporation then.
We are, but the whole Washington Health Trust is not going to be a corporation. That is it's a state-run, publicly funded. The whole Washington's a corporation. So the campaign is a 501c4 PAC. That's what we have to be in order to run an initiative in Washington State. So those are two separate
That I
entities.
understand. What I'm trying to get a grip on is what the government structure, is going to be. But for example, in the federal government, sometimes the federal government sets up nonprofit entities that are part of the federal government. They're even corporations, but part of the federal government. Is that going to be a similar situation, in Washington? Or is that going to be actually a division of the state government, the way CMS is, let's say?
Yeah, I mean, I feel more comfortable with the way that you put the second option. I don't think there's any incorporation that's going to happen with the whole Washington Health Trust. It's a state-run,
check out
public.
Which leads me to another question then. In some of the documentation, that I read through, the idea was stated that while the program is waiting for waivers from the federal government, which could come through very quickly or could take a long time depending on who's in office at that time, that it will still be possible before the WWHT to operate as a particular kind, of intermediary under the law, like an insurance company that acts as an intermediary.
Yeah, I mean, basically, like most other developed countries do it, the government pays the providers directly instead of circumventing basically private insurers. So, and the waivers, what that allows us to do eventually is to streamline all those revenue funds into the whole Washington Health Trust. But in the meantime, people who are on Medicare or Medicaid or the VA, like my husband can say, oh, I want to utilize this system, so I'm going to pay into it. I'm going to pay the premium, and I'm going to get this gold standard plan, and I can, get 0 deductibles and vision and dental. So people on Medicare and Medicaid can still opt in. I don't know why somebody on Medicaid would, because it's, Medicaid's pretty great here in Washington State. We have AppleCare, which is very similar to the whole Washington Health Trust, 0 copays and deductibles. So someone on Medicaid might not want to do that, but somebody on Medicare, I can totally see would want to opt in to the whole Washington Health Trust, because currently with Medicare, you only have 80% coverage. You have to get all sorts of supplemental plans. Vision and dental are covered. So the whole Washington Health Trust would be a huge improvement for people on Medicare.
Right. Okay. So, but in terms of the understanding of how this works, if someone was to opt in, then how does the federal government, how does the CMS actually get billed for their health care by the state of Washington?
So the federal government wouldn't get billed because they'd be paying the premiums for the whole Washington Health Trust. So I would really recommend, so Medicare, the whole Medicare part is pretty complicated. On our website, you can actually go and read all about how, if you're on Medicare and you opt into the whole Washington Health Trust, that would work for you.
Yes, I did read that part. It was not entirely clear to me how this works as a legal matter. And I thought it was important to try to clarify that.
Yeah, again, if somebody is on Medicare and they opt in, then they'd be paying their premium to the whole Washington Health Trust, and we'd be covering, when I say we, I mean the state plan, would be covering their
so they would be paying their federal premium into you?
No, they would be paying the whole Washington Health Trust premium.
The whole Washington Health Trust premium.
Yeah, if you go look at our funding mechanisms on our website, one of the funding mechanisms is a premium.
Yes, I have looked at that. Okay, already. So in other words, all these things, okay, I've already done. I suppose what I'm thinking of, and the part that I don't really understand, is for someone, okay, who's on, say, Medicare program.
Mm-hmm.
We pay roughly, I think it's $144 a month. Okay, it comes out to, which is the Medicare Premium.
Mm-hmm.
Okay, it's actually deducted from our Social Security each year, each month, I should say. That amount of money, okay, is deducted from our Social Security. Okay, and as a result of being a part, okay, of Medicare, uh, they cover part of our health costs.
Mm-hmm.
So CMS actually pays whatever the obligation is, but for it to pay. Okay. So my question is, for someone, okay, who's on a Medicare plan, who opts into the WWHT, how does the Medicare payments get to WWHT? Okay, in that instance.
Until the waivers are granted, we can't touch Medicare dollars. So somebody would have to opt in and pay our premiums in order to be part of the whole Washington Health Trust. So we cannot touch the Medicare dollars. But I'm going to stop you right here because I didn't write the whole Washington Health Trust, and I really recommend for like those in-depth, in the weeds questions to talk to Cindy Jacobs, who is the legislative expert that we have. I'm more of the campaign side. So when you get really into the weeds, especially with the Medicare and waivers questions, because those are pretty complicated, as you already stated. You read our Medicare section on our website, and
I did.
It's pretty complicated stuff when you think about.
Well, not really so complicated. It just was a little opaque.
Mm-hmm. Yeah, that's what I'm saying. Cindy Jacobs would be a better person to talk to about like how that all works with the waivers. I can answer some like kind of more superficial questions about waivers, but I'm not the person who wrote the initiative. I can do my best, but at the end of the day, Cindy Jacobs or Dr. Gerald Friedman would be way more able to clarify the in the weeds questions.
Okay, so I need to talk to Cindy Jacobs then.
Well, and so Cindy Jacobs would be great with like waivers and how the whole Washington Health Trust is set up. And then Dr. Gerald Friedman would be great for talking about like the funding mechanisms and savings and stuff.
Okay. Okay, so to get to the understanding, okay, of, I shouldn't say the funding mechanisms, but the financing, okay, that we have, okay, at this point. Some of the latest estimates, okay, that have been made, okay, as you and I have sort of exchanged about actually before. In 2021, very loosely speaking, the amount of spending in Washington on healthcare was going to approach about $100 billion, I believe. Okay. And the cost savings that, following calculation of the cost savings that were going to come about, okay, if the WWHT had become law, okay, in 2021, very roughly the savings are going to amount to roughly $33 billion, bringing the overall amount that was going to be spent to roughly $67 billion. Okay, and then the federal monies available to the program were estimated to cover something like 70 to 75% of the rest.
Mm-hmm.
Okay, so that the amount that was going to be left for the people of the state of Washington to cover in some way through the various funding mechanisms, okay, of whole Washington, was going to amount to something like $21,000, okay, in round figures. I'm sorry, $21 billion, okay, in round figures. Okay. Sorry about that. Misplaced a few zeros along the way. So that's kind of from 30,000 feet, the funding picture. And that's what Jerry Friedman's analysis seems to show.
Yeah, I think a lot of people get really overwhelmed with the idea of having to find money for 100% of the Washington state residents or 100% of the United States residents. But what they don't understand is that we actually, with Medicaid, Medicare, IHS, VA, are already covering a significant portion of the residents in our state and in our country.
Oh, yes, it's absolutely true. Not only are we covering a significant portion, since there's no deficit spending when it comes to Medicare or all the other government programs, sooner or later, it's all coming out of private sector pockets. In other words, the way it's funded, either in the past or right in the present, is coming out of the private sector pockets. Now, we know that the taxes don't pay for anything as a technical matter, but we also know that the taxes are the offsets, okay, that actually allow the funding structure to work. I'm putting that, okay, in the wrong way also, but I don't want to get into the MMT technical details here because I don't think they're really relevant, in terms, okay, of what we're talking about. The fact is that that money is flowing from the people, but to the tune of the total amount of spending that is being done by the governments for the health care people get.
Mm-hmm.
In other words,
well,
in one way or another, that money, okay, is coming out of our pockets. And but when it goes to the federal government, the money is destroyed in the process, okay, of settlement. And when it's going into the coffers of the state government, then it goes into a bank account somewhere, and the tax money is paying for something. Okay, so I suppose what I'm trying to say is that we're not getting any free money from the government in this particular process.
Yeah, and I would like to point out also that when the way that our system is set up with the VA, the IHS, Medicaid, and Medicare, it is allowing insurance companies to basically shove out the most expensive patients onto a system not theirs. So that makes them even more profitable. And that's what the appeal of single payer is. I mean, obviously, the main appeal is, like every other developed country experiences, better healthcare results as a result of their single payer system. But the appeal is to stop allowing insurance companies to make somebody else foot the bill for the most expensive patients while they reap a ton of profit off of people who have employer-based insurance.
Yes, that's a big part, okay, of what's going on in terms of what a single payer system is supposed to do. Okay, but another big part is that it's just supposed to allow us to spend far less in terms of the whole Washington example It cuts down the total expenditures from roughly 100 billion to roughly 67 billion. Okay, and when talking at the federal level, some people have even claimed in round figures that it could save as much as 50% of what we would otherwise spend. So, for example, as a percent, okay, of GDP, okay, a NEMA program, instead of spending nearly 20% of GDP, okay, as we do now, we might be able to create a program that would take us down to 10%, okay, of GDP, which means 10%, okay, of GDP would no longer be going into the pockets of the healthcare industry. Instead, they'd be going elsewhere, and the economy would not be so unbalanced towards spending on healthcare.
Yeah.
So that's another big part of things. And the third big part of things is no one would be dying due to lack of insurance, and no one would be dying due to lack of adequate insurance either. And nobody would be going bankrupt, and nobody would be going through divorces as a result of financial stresses and strains, and there wouldn't be any mortgage foreclosures, okay, and there wouldn't be any crime impacts as a result of all this. All that would be gone. So these are all the things that single payer is going to do for us.
Mm-hmm. Yeah, it's really criminal when our elected officials refuse to pass it. Well, that second point that you made reminds me of, like, recently in New York, some of the main unions came out against their New York Healthcare Act.
Yes.
And when you said that it frees up all that money for GDP, when you're spending a whole lot less of your GDP on healthcare, you can spend that money elsewhere. Well, that reminded me a lot of the union situation, because a lot of union leadership are afraid of universal healthcare, Medicare for all, because that's a huge percentage of their bargaining time is negotiating better healthcare for their membership. And so sometimes when I talk to union leadership, I get the sense that they're afraid that their members will have less reasons to pay their dues if they have universal healthcare. And I think that's absolutely not true. If you look at other developed countries, they have much stronger unions because they're negotiating for more tangible items like more paid time off, maternity, paternity leave, better wages. Those sort of things are what is appealing about unions in those countries. And it would be more appealing for members in this country if they thought, oh, well, if I get this union job, I'll get $45 an hour, 4 weeks vacation. Healthcare benefits, yes, they're appealing, but gosh, that's like not as much of an incentive in my mind to become an employee, maybe to stay an employee. I'm scared that I might lose my healthcare benefits, but to become an employee and a member, paid time off.
The healthcare benefits may be very important when you don't have a government program that is giving you healthcare benefits. But when you have that program, then you get a chance to negotiate for time off, for a better family life, higher wages, better standard of living, okay, and a better quality of life. And that's what's happened in every other country. And we're stuck trying to get the healthcare benefits that should be coming from the government in the first place.
Yep, 100%.
And that's a way to look at it, I think.
Yeah, and we're lucky here in Washington State. We have the president of the Washington State Labor Council, Larry Brown, who wrote a really great op-ed to the one of the union publications in our state, talking about how Medicare for All would allow us to take healthcare off the negotiation table so that they can negotiate for better things. So that's one of the advantages we have in Washington State, is that our Washington State Labor Council president recognizes the benefits of taking healthcare off the negotiation table.
Okay, so let's go just a little more to the relationship of whole Washington to the national movement. You've already said that you're very committed to the national movement. and are very interested in the national movement. And you're wearing a red beret, okay, as well. So try to describe for me, okay, or narrate for me, tell me a story about the interactions between the national movement and the whole Washington movement, and how it works.
Yeah, I mean, we've put on barnstorms for National Nurses United. I think we organized 12 in 2019, 12 barnstorms for, it was either right before or right after the hearings. And the communications director of Whole Washington, Jen Nye, and I actually went to the hearings, which was really exciting. And we got to visit each one of our Washington state reps. We had like some volunteers who had already allowed us to use their names, like in constituents of different representatives here in Washington state who have so far refused to co-sponsor Medicare for All. And we went and lobbied our representatives to get them to commit to co-sponsoring. Unfortunately, we still only have 2 co-sponsors here in Washington state for the National Medicare for All, despite all of our efforts. So yeah, we've been really, really active. Most recently, we did that Derek Kilmer event. We had about 100 people, I think, show up outside of his office, which was pretty good during a pandemic. And let's see, what other events have we put on? Oh, I put on a car parade here in Spokane for Medicare for All and NNU. So yeah, whenever they have a call to action, we send it out to our database. And yeah, I mean, obviously that's the #1 priority is Medicare for All.
So whole Washington is actually responding to all the national calls for action that come from the national pressure groups, okay, organizations. But this year, or more recently anyway, there doesn't seem to be much activity from the national organizations. They seem to be focused on just expanding Medicare into different areas and lowering the age of Medicare from 65 to 60. Mm-hmm. So has that in any way reduced but the activity that you engage in for Medicare for All, or is there still plenty to do?
I would say that it has been a little quiet, although I think NNU just had a national strategy call. Unfortunately, due to personal circumstances in my life, I wasn't able to attend that one, but I know that a bunch of our volunteers went to it. I think they're going to start the pressure campaign to procure more co-sponsors for the bill. But I know this is going to be unpopular for some of the people who are currently tuning in, but I actually do support the Medicare expansion, and I'm going to tell you why, what my reasons are. A lot of the times when we go out and we talk to people about Medicare for All, they say, but Medicare isn't great. Why would we want Medicare for All? It only covers 80%. It doesn't cover vision and dental. I have to get all these supplemental plans. My prescriptions aren't covered. I feel like we would neutralize that argument, that concern, if we had a Medicare system that wasn't slowly being privatized and that actually was comprehensive. So that's my feeling about the Medicare expansion and the lowering of the age to 60. For me, it's more about making sure that Medicare is actually a good public system that's very strong, that people trust. That's the reason why it was called Medicare for All originally. We all know that it's not actually Medicare. It's a single payer program that's much better than current Medicare. But the reason why they use Medicare for All is because it was a trusted program that so many voters like and rely on. But slowly the private insurance industry has been able to chip away at it. And then
yes, I'm very familiar with that. I was forced into a Medicare to a Medicare Advantage program just this year by Kaiser.
Mm-hmm. So if we could take away that argument that I hear very, very often when I'm talking to, especially kind of like moderate Democrats, because I'm a state committee member for the Democratic Party. So I run into a lot of the moderate Democrats who are like, well, I mean, I'm on Medicare, but it's not great. Why would we want Medicare for all? We need a different system other than Medicare for all. If we could make Medicare as great as it was intended to be, then we wouldn't have that argument.
I think that's a good point. Okay, but if I can respond from the viewpoint of someone who is on Medicare right now and who stands to benefit from the expansion, of Medicare greatly, it seems to me that if one is for Medicare for all, and that is the goal, the objective, and you're looking for mass support for that goal, that it is then very damaging for the federal champions, of Medicare for all, not to be doing all they can to get a Medicare for all bill actually passed. What the effect of that is to deactivate the movement and to go away from the not me, us kind, of model. Mm-hmm. From my point of view, I have very much resented the fact that there are decision makers in Washington, like Bernie, and Jayapal as well, who have decided not to push for Medicare for all, who have made certain political judgments of their own that certain things are possible and certain things, but just are not. And so they're not going to push for those things that they judge not to be very possible, when they don't really know what's possible because they haven't tried to activate the whole movement. They've been turning off the movement for more than a year now, since Bernie Sanders withdrew from the campaign.
Well, I would agree with you. I think that they do need to still push for Medicare for all. And that has been disappointing that they have just pivoted instead of doing both, because I think that they definitely could do both. But one of the things that does bother me about it is that I once spoke to a union organizer about this sort of thing, and they gave me some great, sorry, I'm a very friendly fly. I don't know if you've noticed. So if I'm waving, it's because there's a fly. But
that's right. But I wave a lot too, so I just thought it was what you did.
So, but if you come to the union organizer said, if you come to the negotiation table asking for less than what you want, you'll never even get that. So yes. That's kind of how I feel about dropping Medicare for all. Is that you should have that as your gold standard and say this is what we want.
Yes, and you should be fighting as hard as you possibly can to get that. And then if all the forces, are arrayed against you, when it's come down to the final moments, then of course, if you have to take a worse deal than that, then you take a worse deal. But you don't start off fighting for an expansion of Medicare to, how did they put it, 60 or 55? If you come out with a public statement, we want 60 or 55, then the other side immediately says, 55? What are you talking about? 55? You already said you were going to take 60. So we're not going to talk about 55 anymore. We're not even going to mention 55.
Yeah, well, I mean, we're Democrats and people on the left are historically bad at politically maneuvering. So, I mean, I feel like that's the whole story of the ACA was that, right?
Yeah, that's right. But we can't accept that as an excuse. I mean, this is Bernie. This is Jayapal. These are supposed to be our champions. They shouldn't be acting this way. Why are they acting this way? It's a puzzle for me.
I mean, if I was gonna try to think of a reason, maybe it would be because they want to win. I mean, I think that's.
They want to win what?
Just anything. They want a win, not to win, a win. And sometimes.
Isn't that how we got the Affordable Care Act piece of junk back in 2009 and 2010? Isn't this the same?
I mean, I don't think I would say it's the same. The Affordable Care Act is
I'm not saying it's the
gifts to the insurance companies. Whereas
I'm not saying it's the same as the Affordable Care Act.
Okay.
But what I'm saying is it's the same kind of reasoning that people were doing in 2009 and 2010 that got us the Affordable Care Act. I mean, it's exactly the same. Why did they accept the Affordable Care Act? They accepted it because we have to get something. We have to get something.
Yeah.
What I want them to do is stop being beggars. I mean, that's what it comes down to. They're acting like they're beggars. And they're supposed to be people we employ. So they shouldn't be begging. They're supposed to be fighting.
Yep, I agree. And I'll be the first to tell you that I've been very disappointed with the lack of support some of those leaders have shown to grassroots organizations that were inspired by them. No endorsements, no help, no nothing. But I mean, we keep fighting. That's at the end of the day, that's all we can do is keep fighting because we know that so many people are rationing their insulin. Seniors are cutting pills in half. And it's just, it's an unsustainable system and it's got to change. It has to change. Despite what some of those leaders do or don't do, we have to keep fighting.
Right. So from the standpoint of our roles, which are on the bottom, we need to keep fighting by letting our people know that we're not really pleased with lowering the age to 60, okay, and expanding, into dental vision, okay, and hearing. That, but for us, that is kind of a minimum, but we don't see it, okay, as much of a victory, and we want to know why they see it, okay, as much of a victory. In other words, they're the ones who were promising H.R. 1976. Anyway.
No, I mean, I agree with you that it is demoralizing.
Right.
They're not reading the room as far as their supporters. I don't think.
But I think to avoid being demoralized by this, what you have to be in relation to this is angry. Anger plays a real function here because it keeps you fighting and stops you from getting demoralized. Because we're too busy to be demoralized.
No, I mean, I say something similar. You just got to keep being effective at organizing. Okay. I mean, for me, anger actually lessens my ability to be effective because then I just shut down. So, but everybody's different. If anger motivates you, then okay. But for me, it's like looking at what I can affect positively and accomplish in a day, and to be like, look back at the day and say, oh my gosh, I sent out, 3,000 texts for the National Medicare for All marches, which, I did.
Right, but that's very important. That's still fighting for Medicare for all, isn't it?
Right. So that's what I'm saying is, like, if I can, and I know that a lot of volunteers with Whole Washington and a lot of board members with Whole Washington are also upset and upset and feeling abandoned right now. So for me personally, I like to inspire people to figure out how to change what they're upset and angry about.
Right. Okay, so let us go away from this topic and let us move to the state level movements, to onepayerstates.org. Okay, what you know about that, and how you see those movements starting to develop, and how you see the interaction of those movements with the national movement for Medicare for All.
Yeah, I mean, there are lots of organizations that are a lot like Whole Washington that work for a bill and the national plans. Some organizations, they are in states that they have absolutely no chance to get legislation introduced for single payer or any chance of passing a universal health care initiative, but they're still fighting for national Medicare for all. One of the things that I'm passionate about personally is going and giving presentations to groups like that. I've given presentations to, I don't know, about 10, I think, ish groups around the country, teaching them how to use campaign tools like Action Network, ActBlue, WordPress, text banking tools, that sort of thing, so that we can learn about each other, not reinvent the wheel, and strengthen each other through our solidarity.
Right. So I suppose you have a lot to teach people, okay, in other states about how to organize for a single payer plan. There's a lot of information about single payer plans. But true?
Sorry, you cut out. What was the question?
Okay, the question is, you have a lot of information about how to formulate a single payer plan at the state level, which you can give to people, okay, in other states, and which you do give to people, okay, in other states. Is that true?
Yeah, so I'm more on the campaign side, so I teach people campaign tools. I don't really get into the legislative aspect of it. So I teach people why social media is important, the different types of social media and how you can use it to organize. Mainly, I like to teach people how to use Action Network for their organizations, because that's a database tool where they can send out emails, they can petition their elected officials, they can do letter writing campaigns through that, and actually now text banking. So tools like that, where maybe an organization is just starting up, they don't know how to start, recruiting volunteers and getting them to make phone calls to their representatives, whether that's in their legislature or whether that's their national representatives. That's what I like to do. I'm more of the technical aspect of organizing a campaign.
I see. So what kind of sharing of single payer proposals is going on from state to state?
I think there are probably a lot of similarities in different types of legislation. I think that a lot of organizations use Medicare for All as a good template. But I don't know necessarily if we're sharing legislation specifically. I mostly just share campaign tools. But I know that I've talked a lot about our solutions to waivers and transitioning people into the system before waivers are granted. But again, if they wanted to get into the weeds with that, they would need somebody like Cindy Jacobs to tell them how exactly that is structured. So I'm more like, okay, here's this database tool. This is how you can use it. I can help you set it up, and I can train you on it. That's my wheelhouse.
Who would I talk to from Whole Washington about this question? okay, of people sharing knowledge, okay, of legislation from state to state?
I think that there are probably some people with one-payer states who they analyze the legislation. I'm not sure if there is any sharing of the legislation per se. I know that different people who are single-payer experts look at different pieces of legislation for maybe pitfalls. But as far as actually sharing a template for a single payer system that many different states could use, I don't think anybody's really doing that right now.
That is really something very interesting, because on the right, okay, ALEC shares templates all the time with different states, which is one reason why they've been so effective.
Yep.
And why the Republicans have been so effective in the voter suppression from state to state, because they're sharing model legislation. So the question, okay, which immediately arises is, why can't we do that in this area?
We should. I don't think there's any reason why we can't. I mean, the funding is going to be the challenging part, because like I mentioned earlier, we don't have an income tax. So where some states can utilize an income tax to pay for their system, we don't have that. So there would definitely have to be various strategies for funding based on what kind of tax system a state has.
Sure.
The setting up of the trust and that sort of thing could be similar state by state.
But the same kinds of savings that Gerald Friedman, okay, is seeming to project, but for Washington, in terms of the overview anyway, would probably apply to other states, okay, as well. In other words, it would probably be similar savings of 30 to 35% coming out of single-payer plans if they tap the same federal funding sources, okay, that you have targeted in whole Washington. In other words, that would be available to all states, right?
Mm-hmm. Yeah. I mean, some states have more wealth than others, so it might be more challenging to come up with funding. But in the end, like you said, it saves money. So, I mean, at the end of the day, the system that's created will be less expensive than the system any state has currently.
Right, but also in terms of the example, okay, of Washington, you are still heavily relying from 72 to 75%, okay, of the sum in between that 67% we talked about, okay, and 0%. 75% of that would be covered from federal sources.
Mm-hmm.
And that sort of thing would apply to every state, would it not?
Well, some states probably have a lot more, people on Medicaid or Medicare. So
they might even have a greater percent, okay, of available funding from the federal government, or potentially available funding from the federal government. Okay, so their share, okay, of the total, if Washington's share of the total is 21%, okay, it might even go down in some states to 10 to 15% if those states, okay, are poor enough, like some of the red states are, right? So won't very many states be interested in the funding template, but that you've come up with in whole Washington?
Yeah, I mean, if maybe more the savings estimation, but yeah, I mean, the problem is our income tax is so challenging here, and so they probably wouldn't have to have some of the other funding mechanisms that we have in our bill. If you're in Oregon, they have an income tax. We always talk about the West Coast states, how they could form a block and
Yeah, that's something I talk about a lot.
Yeah. So, and California and Oregon would have it easier since they have an income tax and they're not regressive. Like our state constitution says that we have to tax income uniformly, whereas somebody like a state like Oregon and California, they already have progressive taxation. So it's a little easier
but for you. The key funding mechanism is payroll taxes, actually.
Mm-hmm.
In other words, in terms of the percent of the funds.
And capital gains.
But capital gains, in other words, I thought I computed it that the payroll taxes counted for something like 87% of the funding that was coming from the state. So the capital gains, while certainly substantial, is probably no more than 5 to 6% of the total.
Yeah, I don't know the percentages off the top of my head.
Yeah, I took that from Jerry's paper.
Okay.
It's something like that anyway. I'm sure I'm in the ballpark. I don't exactly recall the precise numbers, but I think I'm in the ballpark about that. So for all states, that option would be there to increase the payroll taxes if they wanted to. And most of the increase, in payroll taxes actually falls on the businesses, right?
Mm-hmm. Well, yeah, a lot of businesses are paying upwards of 15% right now for their private health insurance. So 8.5% is a big...
would still represent the savings. So from the viewpoint of the state, it's very important in terms of the revenue. But from the standpoint of the business, it still represents a saving. So it's advantageous to the business people too. So it's a win-win for both sides.
Yeah, there's a great movie out of Canada called Fix It, and it's like from the business perspective, like Canadian business people talk about how much better the single payer system is for them as entrepreneurs in Canada. So I really highly recommend that one. Because one of the things that we have a hard time with is convincing big business owners that it's a good idea to go to universal healthcare. And watching a movie like that, where business owners in Canada are saying, this is way better for us.
Yeah, that is a great thing to show to our business owners who don't seem to realize it would be a great thing for them, right?
Exactly. And there's a lot of conservatives too who, one of the things I like to show, this book, The Purple World, is a great...
Joe Q. Jarvis.
Yeah.
Who is going to be here tomorrow night, as a matter of fact.
Oh, that's awesome. What a coincidence. Yeah, I have this book by me all the time because he is a conservative from Utah, and he makes a fantastic case for single payer in this book. And he was a former public health official, actually. But that's one of the cases that you can make when you're talking to conservatives, is how good it is for small businesses for people to not have to worry about the enormous cost of providing healthcare to their employees or to themselves. That's another thing. If you're going into business for yourself and you look at the cost of healthcare for you and your family, you say, oh gosh, I got to stay at this job I hate because I can't afford the premiums, copays, and deductibles to leave my job.
Yes. Okay. So, how do you see the movement actually either growing or not growing through the various states?
Yeah, I think we're talking more than ever. We've all been in our own little silos. And one of the things that we've been doing with Whole Washington is reaching out and saying, hey, these are the campaign tools, like I said, that we're using. You need help with them. So through that increased communication, I feel like our state efforts are really helping amplify national efforts. So it is growing. It is growing. Of course, it's way slower than it needs to be, that it should be, because people are dying. And so it's hard to not get impatient with how slow our movement is growing. But it's difficult right now with COVID and
Yeah, certainly. So could you give me some idea of which of the states where the movement is now moving the fastest?
Yeah, I would say New York and California and Washington are the three that have, I feel like, the strongest legislation and the most solid grassroots organizations supporting that legislation. But there's also like Mass Care. There are organizations in Maine that I've talked to. Dr. Joe Jarvis is starting an organization in Utah around single parents. So I even got reached out to by somebody in New Mexico who wants to start a whole New Mexico. So it doesn't really, maybe not have the same ring as whole Washington, but
that sounds pretty good to me.
Yeah.
New Mexico.
But it's great for me too, because I'm from Albuquerque. I'm like, yes, do it. But yeah, I mean, lots of people are definitely getting on board, and those marches were fantastic. It was amazing that they had 60 plus events.
The 56 cities marches, you mean?
Yeah, like brand new organization, and they had so many awesome events around this country. That's, things like that inspire me.
Yeah, that inspired me too. And it was really amazing considering the lack of support that they were getting from some of the national organizations. In spite of that, to get 56 city marches, that was a tremendous accomplishment.
I agree.
How do you see the movement in Pennsylvania? Is there anything significant that's going on there? Point of view.
I'm not sure. I haven't heard anything about that, but I could look it up.
But because for years I've been hearing that they have a pretty good movement going actually in Pennsylvania. A good bit of support. I've also heard the same with respect to Minnesota. And I remember back during the fights in 2009 and 2010 that there were a lot, of Minnesota people who were interested in the single payer back then. Also, Lana Dell is here tonight in the comments. And I think she's in touch with some of the single payer people in that state. Am I right, Lana? Am I distorting things, or have you been in touch with the single payer people in the state of Minnesota? She'll help us out here in just a second, I'm sure. Okay, so anyway, I think maybe Pennsylvania, but, and also Minnesota have something that's going on. I don't know what's happening in Florida. Okay. I have a feeling something must be going on in Texas, even though the way right now is totally blocked by the state government. Still, I think things in Texas are probably very volatile right now. And given that certain other things happen, there could be a radical shift in Texas coming up pretty soon. I guess we can always hope, in any case, right, for that.
Definitely.
Okay, tell me something about the neighboring state, of Oregon.
Well, they've had a bill in their legislature for quite some time now. I think they just got something passed through their previous session, basically codifying that healthcare is a human right. But the actual universal healthcare bill did not get passed. So that's what we're fighting is either representatives who take a lot of corporate cash and don't want to pass this legislation, or they're just scared. too big of a leap for them. They're willing to pass little things like healthcare as a human right, or let's study this. We'll study single payer.
So you don't see the movement in the state of Oregon is very strong at this point.
They have a great organization, Healthcare for All Oregon. Their legislature is doing the same thing our legislature does and California's legislature does, which they give.
But don't they have the initiative available to them in Oregon as well?
They do, and I know they were discussing maybe running an initiative, but then COVID hit, and I think that a lot of people have really been terrified of trying to collect signatures just because of, how difficult that whole process is under normal circumstances. So, yeah.
So just to move to California, that's, of course, really in flux now because of the recall.
Mm-hmm. Yeah.
Okay, there are three possibilities, in terms of the recall. Either Newsom is okay and he continues on. What implications do you think that has for single payer in California?
Well, I mean, it's hard to say. I feel like no matter who is the governor in California, I mean, maybe one day they can have a great progressive. But Anthony Rendon really fell on his sword so that the governor didn't have to face the wrath of single payer advocates if he vetoed the bill. So I feel like there are plenty of representatives that are willing to fall on their sword in the legislature so that the bill never even hits his desk.
Okay, so you think that he won't be under any pressure to pass the bill?
And that he might. NNU or Cal Nurses and Healthcare for All LA, they will pressure him. But there will definitely be someone to take the fall for him, so that it never shows up at his desk. He can say, I'm for it, I will sign it, but then it will never show up at his desk. These are the kinds of tricks that politicians play. In my opinion, that's what's happening, is he says, he calls it a favor.
Right. But if he should but suddenly come out in active support, of the bill, and campaign across the state, would that create a different situation in California?
Perhaps. But Vermont, look at Vermont. The governor was so in support of their single payer bill. He ran on it. He promised he would pass it. And then, he lost the political will to do so.
Yeah, well, I suppose I don't know what was exactly going on there. I know he brought in the wrong consultant.
Mm-hmm.
What I don't know is if he brought in the wrong consultant because he had already lost the political will, or whether he lost the political will because he brought in the wrong consultant and he got the wrong verdict, in Medicare for All. I mean, it seems obvious to me the guy's model was spitting out junk. Mm-hmm. In other words, just based on the financial analysis that Jerry did for whole Washington, there had to be a similar financial analysis that could have been done for Vermont, at that time. Mm-hmm. And then there would have been an entirely different recommendation as to what, could have gone on there. Mm-hmm. So it was actually down to Jonathan Gruber in some way, unless Shumlin had already sold out. Mm-hmm. Yeah, I mean, I can't exactly say what happened there. There was one last thing I wanted to ask you. Concerning California. Of course, if it turns out that Newsom loses, and Larry Elder is the choice for governor, What kind of impact does that have on the possibilities for single payer in California?
I have to admit, I don't know anything about Larry Elder. You saying his name is the first time I've heard it.
Okay,
so,
well, he's a conservative talk show host.
mm,
He's a Trumpist.
mm,
He's, for him, almost the worst thing in the world would be single payer. It would be complete anathema to him.
Well, I mean, in California, when they had their last Republican governor, the California legislature did pass the single payer bill, knowing that the Republican governor would veto it. So I'm sure similar shenanigans will take place.
I think that's probably right. Okay, and then the third possibility, of course, is that he loses the recall. Okay, but Larry Elder is not the person that's selected, but that one of the other people who is more progressive and who might sign a single payer bill, okay, is running. So then what happens?
Well, then we hope that that the people in the legislature pass it so that it shows up on his desk. That's probably the most the best chance a state has right now. Just because I have my own suspicions that Inslee would probably pull the same sort of ballet dance and get an Anthony Rendon here in Washington State to ensure that our bill never makes it to his desk. He's kind of, well, I could go on and on about his public option, but I won't. But so that sounds very promising for California if that happened.
Okay, so I guess we'll know in about a week, right?
Yeah.
Unfortunately, we'll know it's
going to say so. I haven't been able to pay much attention to things. So we agreed to host an exchange student from Spain.
Yeah.
So the last month of our lives has been dealing with that, and then also my daughter's heading back to school soon. So lots of stuff happening with my family right now. So politics hasn't been at the forefront.
Okay, I certainly understand that very, very well. We are now at roughly 10:33. Okay, I am going to move to the comments section. If you would like to stay for longer, you are welcome to stay. If you would like to say goodnight now, then you can certainly do that. Okay.
Well. I'll go ahead and say goodnight, and thank you so much. I'm going to head up and eat some dinner. I'm starving.
Okay, I'm sorry to have interrupted you.
Oh, no, it's fine. It's just my husband's cooking, and I can smell it, and it smells so good. It's his fried rice. He makes really good fried rice. So
that sounds very good.
Yeah. But thank you so much for having me on, Joe. I really appreciate it.
Okay, it was a great pleasure, George.
Bye.
Thank you very much. Good night. Okay, folks, here we are again. I'll be going back to the beginning. Anxious to see your comments on this one. So Laura says, I share it to a ton of groups, including Seattle Women Marching Forward, Seattle Women's March. And Lisa says, hello, folks. Hi, Lisa. And Jeffrey Denton says, what is maroon and silver? What is the significance of that, Jeffrey Denton? But Bernie and the squad promised they were going to fix our country for us single-handedly, didn't they? I mean, that's where the not me, us part just comes in, right? They didn't do that. They made their own decisions, so it turned out to be me and not us. That's the way I look at it. They made their own decisions without even so much as trying to consult us. They could have tried to consult us. They could have polled us. They both had the capacity to do that, but they didn't exercise that capacity. Shane is here, and he says hi. Laura says November 19th. We'll see you in Vancouver for the protest outside Senator Annette Cleveland's office to demand a public hearing for all Washington's bill, followed by a candlelight vigil. That's Scott Denoyer, Anna Shumpus Denoyer, okay, and Emma will lead, and that will be live streamed, and Kenny Ballantyne will film. But that messaging is strongly a demand for a federal hearing and an observance of 68,000 sacrificed every year to the profit motive. Kenny will be getting Georgia Davenport interview for H, and it stops there. Evelina Pond says, you have a regressive tax system in a supposedly progressive Democratic state. Shame on Washington legislators. Laura Fielding says, I learned fight on all fronts from Ho Washington, very much Georgia Davenport. We miss her very much here in Western Washington, but very happy that her family loves their new home. Evelina says, Ho Washington is the saving grace, along with other likable things about Washington state, Evelina says. And Scott Denoya says, much love, Laura. You know, I can never turn down the opportunity to fight for our health care. We all know those that profit off of the sick and dying will never rest. Kay says, not for profit was when health care was great. Evelina says, whole Washington is still a corporation, though. Well, the organization trying to pass the initiative, okay, is still a corporation, but the whole Washington Health Trust is not going to be a corporation. It's going to be actually an agency, okay, of the Washington government. Kay says, Ohio used to be the best in the world back then, not now. Jeffrey Denton says, 116 countries around the world with universal health care, but I trust the government and the media of the country that doesn't. It doesn't tell anyone about these other countries because that makes logical sense. Jeffrey says, no, we're just volunteers. The boss isn't a policy wonk person. And Kay says, Medicare is way too complicated these days. Ghost Start says, hey, all rough W-E, not sure what that means. Kay says, figures they ruined Medicare right when I needed it. Jim Bird says, love the hat. So do I. I love my red berets. Fran Bauer says, so glad to see George on your show, sharing her wealth of knowledge and expertise. Well, thank you, Fran. I hope to call on your wealth of knowledge and expertise in not too long a time. Laura says, hello, Fran Bauer. Just so everyone knows, Fran crochets so many red berets to whole Washington to help our campaign to open the floodgates for the United States. So please ask Georgia Davenport how you could order a red beret. Well, since I don't get to see the comments usually until the end, that's not something that I can ask her now, Laura. But I'll tell you what, if you can put in the comments, okay, a comment about how everyone can order, okay, a red beret, that will be very helpful. I'm sure you can do that. Or if you want to, you can quickly jump on here. I can certainly send you the guest link and you can come on and explain how to do it yourself, okay, if you would like to do that. In fact, I will use my direct line to you. I will DM you the guest link. And if you like, you can hop on and you can do it. So that's it, Laura. You can have it now and you can join me for the rest of the comments. And you'd be very welcome. So, Kay says, some unions use health care as a weapon too. I know they do. Jeff Denton says, Fran, but Donna Marie and Dolores Pierce are all Red Berets in Florida. Oh, well. We have a Red Beret contingent. Fran says, hi, Laura Fielding, mailing out latest shipment of berets to Georgia this week. Laura says, you're a wizard, Fran. We're so grateful to you. And Fran says, I didn't know that. But Donna Marie, Dolores Pierce, we're in Florida. And Fran says, thank you, Laura. I am the grateful one. And Jeff Denton says, yes, I pretty much missed the part when Bernie Sanders or anyone else told people they're going to go around, going to go ahead and fix their country for them. They don't even have to get up out of their chairs. I wouldn't say anything but the people who repeatedly obsess over actually thinking someone else told them they would fix their country for them so they didn't have to get off their lazy ass, never talk about politicians. They've been taking dirty money to block healthcare reform for. Fran Bauer says, we're on our own. No one is representing us. Hashtag M4A. Hashtag FOAF. Kay says, I agree, Joe. We should not be beggars. Carmen says, Hulk in a red beret. Thank you, Carmen. I'll remember that one. Jeff Denton says, I guess the only logical explanation for the reason Bernie and the squad aren't fixing everything single-handedly all by themselves is they must be taking dirty money like the politicians at the squad. Pressure people never talk about. I don't believe Bernie is taking Bernie money for a minute. I'm sorry, that Bernie is taking dirty money for a minute. Okay, I don't believe that. I don't believe the squad is taking dirty money either. I don't believe Jayapal is taking dirty money either. I think there's something else going on there. And Shane says, the quote unquote lefty senators, Sanders, Warren, Market, etc., any one of them could block all legislation and demand a vote on Medicare for all in exchange for allowing legislation to pass. Well, they couldn't really necessarily stop all legislation. Why? Because, for example, when defense bills pass, there are always more than 60 votes for them. So Bernie can't really stop that. He can stop votes where the margin is close. He can put a crimp in Biden's reconciliation bill if he wants to. Okay. But he won't be in a position to stop a defense spending bill, for example. So that's not the way the Senate works. Carmen says, why settle for a slice when you can have the whole loaf? Bernie, Jayapal, incrementalism, and Bernie knows MMT. So does Jayapal. She knows enough MMT to be useful from that standpoint. Now, Fran Bauer says, hashtag mutual aid, hashtag general strike is a best strategy in getting our demands met. I agree, Fran. Jeff says, right before my high school quit teaching physics, I was taught that I was taught that an independent from a very small state was going to fix my country for me so I wouldn't have to do anything. Thank you, Jeff. Thank you. Laura Fielding says, I want to damn well know why, if they aren't going to push for NEMA, why they're not giving it a fighting chance through the state strategy by sending out a damn tweet or an email. Bernie and Jayapal need to endorse whole Washington. I think they do too. I think that's the least they can do. And Ro Khanna could endorse whole Washington too. And it's not because they don't want to upset the Biden administration. Ask George about that press conference Jayapal gave in Seattle in 2018, how she was shutting us out even then. How many people in whole Washington shirts, okay, and by red berets? I bring this up because I'm sure people need to know, is what Laura was saying. And Jim Bird is saying, sorry, incrementalism kills, and period. And Jayapal and the squad were at the pipeline protest in Minnesota with Native groups. Yes, they were. Evelyn says, it does. Saves too few. Laura Fielding says, you should have asked Andre Stackhouse, who has some exciting ideas on the horizon. I'm sure if I remember, if he got into it much in your recent interview regarding building an organization that shares information, and resources. I think he mentioned it, but he didn't get into it but too deeply. He hasn't had much to do with one-payer states, I don't believe yet. The reason why I raised the question with Georgia was because she'd had the one-payer states experience. I'll raise it again tomorrow with Joe Jarvis because I think he has some one-payer state .org experience too, doesn't he? Fran Barrett says www.wholewashington.org, and Lana says, hi, Shane. Sorry, listening on my TV and wasn't looking at my phone. And Jim Bird says, some large corporations are self-insured and make money off the healthcare insurance premiums they charge their employees. But Laura Fielding says, Joe, thank you for inviting so many amazing single-payer champions on your show. I always learn something from your show and still manage after all this time to learn from Georgia Davenport. Very excited to see Dr. Joe Jarvis on tomorrow night, our two favorite Dr. Joes. Thank you very much, Laura. Jim Bird says, and many corps keep raising premiums on their retirees until it pushes them to Obamacare, and most force them to Medicare, then drop their promised paid supplemental and Part D. And Fran says, Sharif. And Kay says, Ohio's pensioners have been screwed too. Ghostart says, the House version of D's Medicare expansion would not expand dental to seniors until 2028. You got to be joking. 6 years after the 2022 midterm elections? Give me a break. Give me a break. Bonnie, we're going to live till we're 125.
No, I'm talking about the climate change.
Well, we'll be here in 2028 for the climate change. It's not happening that fast. Laura Fielding says, https secureactblue.com, donate whole WA merch. Okay, there it is, Laura. Thank you. J.W. Trout said, I was so hopeful about the whole Washington ballot before the initiative was suspended. Are there any other efforts being planned for 2022 in other states? Politicians will not save us. Well, I think whole Washington hopes that it can get back to the initiative before too many more months pass. So don't give up hope about that, J.W. Trout. And Laura says, I linked the merch page of wholewashington.org. Several different crackers' work is available on that page. And BL says, people need to stop shit talking about Bernie and the squad. You all sound like the Trumpers. I don't think I was shit talking about Bernie and the squad. Why do you think I was shit talking about Bernie and the squad, BL? I'm entitled to say where I disagree, and I'm entitled to say where I think that Bernie and the squad have fallen down. That doesn't make me a Trumper, and it doesn't make me in any kind of alliance with the Trumper. Those people need criticism. They need us. They need us to criticize them. They need people to their left, if only for cover. But they also need us for advice, because all they get from the center is a whole bunch of bullshit. And Lisa says, yes, Doc Joe Square tomorrow. And Lana says, please remind that some of us who have coverage for our employer will still recognize that a bad accident or catastrophic illness would bankrupt us. I am very cognizant of this. Hashtag Medicare for all. And Lana's got better coverage than most of the people working for any other employer. BL says, not you, Joe, these others. Yeah, there are a lot of others who are overdrawing conclusions about the squad um, and Bernie, somehow thinking that if they just talk about how the squad has sold out and how Bernie is sold out, that maybe the squad and Bernie will do something that's not a sellout. But I think all that means is that the squad and Bernie, okay, and the others simply dismiss them as not people that they're going to listen to, okay, or watch for. I think their coverage of the squad and Bernie is too negative. They need to be more open to the human aspects of the situation. They're dealing with people who are human beings and who are subject to political and social pressures inside of the day-to-day environment that they operate in. They have a different base of knowledge, okay, than we have, and they come up with different calculations. I wouldn't say for a minute they're right. In fact, I think they're wrong. Okay, but I think that the environment of their immediate situation leads them to different calculations that are wrong. I've also known this for a very long time. This is somewhat of a personal comment. Somehow, for most of my life, okay, I've been something, okay, of an outsider. That allows me to think about things in a different way because I'm not into day-to-day situations which will mold my thinking in the specific ways that institutions happen to mold your thinking. So I've always been able to take an outsider's perspective. For most people who get involved in immediate situations, the problems they're trying to solve in those situations tend to consume them. And if they're the usual people, however well intentioned, who become influenced by their social environments, those social environments can be very powerful influences on them. People can become very conservative about stepping too far out of line for fear of losing whatever influence they have in the particular situation they are in. I think that's probably what's happened to Bernie and probably what's happened to the squad. They haven't completely given up. They're trying to get some things for us. But the amount of risk they will take to try to get things for us is less than the amount of risk that an outsider thinks they should be taking. And Laura Fielding says, Georgia was very gracious to Jayapal in her interview. If people only knew how many tens of thousands of hours that Georgia Davenport has donated to the single-payer movement and organizing a ton for Jayapal's legislation while there is no solidarity or endorsement is returned to the grassroots. I am not nearly as kind. It's time to call her out. And I think you mean Jayapal here, Laura. And I'm not a Trumper for wanting to not waste years of my life fighting harder than progressive members of Congress for Medicare for all. Well, I have to remind everyone, we don't have years left to fight. We have to fight now, and we have to fight hard now, because we have to clear the decks for the next battle, which is the existential battle for everybody, the battle for the climate. That battle we have to engage in right now. We have no more time. And we have to get the Medicare for All bill passed as part of the process. We have to get that off the table in a good way that frees people up to fight alongside us for handling the climate emergency. That is critical now. We can't have people being diverted by the day-to-day concerns and stresses over healthcare that they have now. They need to be freed up to fight along with us to solve the climate problem. Kay says, Bernie is still going around selling Biden's reconciliation bill. Kay, it is not only Biden's reconciliation bill, it has a lot of good things in it for many of us. It is the best bill in many years. It is not a good enough bill. I've told you that from the beginning, but is still a bill that needs to be passed. It's just we have to have a Medicare for All bill passed too, and we have to have those 3 voting rights bills passed. Those 3 voting rights bills have to be passed. And of course, the Women's Health Act has to be immediately passed. But Nancy Pelosi has said it will be immediately taken up and passed as soon as they get back to the House. Then it will be a matter to getting the Senate to move on that. That has got to be done immediately. And by the way, they need to have the exceptions clause of Article 3 and Section 2 in that bill, so that the jurisdiction of the Supreme Court is stripped from that particular bill. And let that be a warning shot across the bow of the Supreme Court as well. Let's get free choice for women enshrined in law, and let's get a warning shot to the Supreme Court that if they continue to persist in this kind of behavior, more jurisdictional stripping will be involved. I'd strip their jurisdiction off the 3 voting rights bills too, not even give them a shot at reviewing those. Fran Bauer says, absolutely, Dr. Joe. And Kay says, yes, Joe, I know that. So he's not just selling Biden's reconciliation bill. He's selling, in part, his reconciliation bill and our reconciliation bill, because that's got enough in it that is very, very good that we would rather see it pass than see it fall. Kay says, yes, I know that. And Fran says, absolutely, Dr. Joe. It's okay, Fran, you can call me Joe. In fact, you can all call me Joe. People have somehow gotten into that habit of calling me Dr. Joe all the time. Okay. So I've come to the end of your comments now. Unless you have some more comments, I'm going to say good night. I thank you all for coming. I thank you for staying this long. And I'm going to see you tomorrow night with Dr. Joe Jarvis. Dr. Joe Q. Jarvis. And Laura says, I had fun knitting. Much love to you and to Bonnie. Thank you, Laura. Thank you very much. I tip my beret to you, Laura. And Laura says, thank you for a great discussion. I love you all. And we love you too, Kay. Lana says, thanks and good night. And Dolores says, good night to everyone, and leaves a heart. And thank you, Dolores. Thank you very much. I'll see you tomorrow, folks.